Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today's time for part 11 on diabetes management. So I hope you enjoy it. This talk is part of our efforts on health promotion, focusing on diabetes prevention and early detection. We also have two health enhancement and weight management programs, ARIS and Janus, so you can become a healthier version of your previous self. If you are interested, call this number, visit our website or our Facebook page. Before starting, I need to say that this talk is produced in good faith for information purposes only. If you need treatment advice, you need to consult your own doctor, or you can consult me in my clinic properly. Also, I'm not going to suggest what drug you should use for diabetes. Let's talk about the anti-diabetes team. The dietitian plays a crucial role, which is sometimes undermined, underrated, and unfortunately underutilized, because diet is crucial. Physicians definitely are important, diabetologists, endocrinologists, general practitioners, but also nephrologists and cardiologists, because the kidney and the heart are important organs that are damaged by diabetes. Podiatrist, the food specialist, is important, eye doctor, physiotherapist or fitness instructor, dentist, but also the medical social worker, because diabetes affects the soul, the heart, the mood of patients, but also their finances. So they can help you for moral support, or to maybe give you a description of the benefits that you can use to pay for all your treatments, etc. Let's talk about the overview of anti-diabetes management. The focus is obtaining good glycemic control, as normal as possible. Indeed, in previous videos, we commented about the risk of hypoglycemia is real and we should try to avoid it, but also mentioned that with ambulatory glucose monitoring, you can achieve safer levels of glucose and minimize the risk for hypoglycemia and better control overall. Diet, weight management, and exercise are crucial. Even you take medications or you don't take them. And many patients are just managing their diabetes with diet, with good glycemic control, and without putting chemicals in their body. Let's talk about some of the anti-diabetes medications. I'm going to present a table, not exhaustive, mentioning some characteristics, advantages, disadvantages of the drugs, just for information. Metformin is probably the most utilized drug worldwide, but when patients have kidney problems, the dose needs to be adjusted, otherwise the blood can become very acidic, and that's dangerous. The DDP4 inhibitors increase the incretins. Remember, in my previous videos, we commented that when after a meal, these hormones called incretins increase to try to stimulate more insulin and bring the sugar after a meal back to normality. So they do that. Linagliptin, for example, doesn't require dose adjustment in kidney failure. They have less chances for hypoglycemia, but other drugs have to be adjusted. Also, these drugs can have some gastrointestinal effects. The SGLT2 inhibitors, they are glucosuric. What it means that they promote excretion of sugar in the urine, which is beneficial to lower the sugar. They also have other benefits like protecting the heart, lower the blood pressure, helping fluid retention, and low risk of hypoglycemia. But by allowing the excessive excretion of sugar in the urine, patients can have more urine infections, which is kind of food for the bacteria. Also, there is an association with limb amputations when using one of these drugs. In addition, people that have kidney problems, these drugs might not work very well. GLP-1 agonists also work favoring this incretin effect. They have been associated with loss of weight, protecting the heart, and low risk for hypoglycemia. But some of the members need drug adjustment in kidney problems, side effects like dehydration, gastrointestinal side effects, can interact with other drugs, and they are injectable. Sulfonylureas are also widely used, but in kidney problems they can accumulate in the body and cause hypoglycemia. They are an important cause of hypoglycemia. The thiazolidinediones increase the sensitivity to insulin, but they can cause gait weight, fluid retention, has been associated with heart failure, bone fracture, and other side effects. The miglitidines are also stimulating the insulin secretion. The alpha glucosidase inhibitors, they can inhibit the absorption of carbohydrates, glucose in the tummy, in the gut. They have also gastrointestinal side effects, but they're not very powerful. Insulins definitely are, very powerful, and they can faster and deeper have a strong effect in blood sugar control, but also high risk of hypoglycemia. But again, if you use insulin, you take ambulatory glucose profile, you can probably dose it better and at better times during the day. You can reveal hypoglycemia. So insulins are very important, and we can now minimize the risk with proper sugar monitoring. But again, in kidney problems, they accumulate and they are injectable. So I hope you like this video. If you like it, give us thumbs up. Please subscribe to our channel. Please share these videos. I believe these videos can be useful for many people. Some people want to know a little more about their diabetes, wants to know a little more about the diabetes their relatives suffer. Please share these videos. These talks are produced for the patients, to benefit the patients, irrespective of they see me or not in my clinic. I just want to benefit worldwide whoever wants to receive some education on diabetes or kidney problems with my other video series. So the next video will be the last of this video series that is on diabetes prevention. Probably later we will publish some other videos related to this topic as a bonus, but as designed, the next one is the last video. So please stay tuned. Thank you for your attention. Take care. Dr. Francisco, wishing you the best possible health. Bye-bye.